Okay, other reasons for a gain from Dr. Simeons, Pounds and Inches. Apart from diet and cosmetics, there can be a few other reasons for a small rise in weight. Some patients unwittingly take chewing gum, throat pastilles, vitamin pills, cough syrups, etc. without realizing that the sugar or fats they contain may interfere with a regular loss of weight. Sex hormones or cortisone in its various modern forms must be avoided, though oral contraceptives are permitted. In fact, the only self-medication we allow is aspirin for a headache, though headaches almost invariably disappear after a week of treatment, particularly if of the migraine type. Well, that should be nice for you migraine sufferers. Occasionally, we allow a sleeping tablet or a tranquilizer, but patients should be told that while under treatment, they need and may get less sleep. For instance, here in Italy, where it is customary to sleep during the siesta, which lasts from 1 to 4 in the afternoon, most patients find that though they lie down, they are unable to sleep. We encourage swimming and sunbathing during treatment, but it should be remembered that a severe sunburn always produces a temporary rise in weight, evidently due to water retention. The same may be seen when a patient gets a common cold during treatment. Finally, the weight can temporarily increase, paradoxical though this may sound, after an exceptional physical exertion of long duration, leading to a feeling of exhaustion. A game of tennis, a vigorous swim, a run, a ride on horseback, or a round of golf do not have this effect. But a long trek, a day of skiing, rowing, or cycling, or dancing into the small hours usually result in a gain of weight on the following day, unless the patient is in perfect training. In patients coming from abroad, where they always use their cars, we often see this effect after a strenuous day of shopping on foot, sightseeing, and visits to galleries and museums. Though the extra muscular effort involved does consume some additional calories, this appears to be offset by the retention of water, which the tired circulation cannot at once eliminate. That's why he says no exercising unless you already exercise. Don't start any new exercise. Okay, appetite-reducing drugs. We hardly ever use amphetamines, the appetite-reducing drugs such as dexedrine, Dexamyl, Preludin, etc., as there seems to be no need for them during the HCG treatment. The only time we find them useful is when a patient is, for impelling and unforeseen reasons, obliged to forego the injections for 3 to 4 days and yet wishes to continue the diet so that he need not interrupt the course. Unforeseen interruptions of treatment. Okay, just a minute. If an interruption of treatment lasting more than 4 days is necessary, the patient must increase his diet to at least 800 calories by adding meat, eggs, cheese, and milk to his diet after the 3rd day, as otherwise he will find himself so hungry and weak that he is unable to go about his usual occupation. If the interval lasts less than 2 weeks, the patient can directly resume injections and the 500-calorie diet, but if the interruption lasts longer, he must again eat normally until he has had his 3rd injection. Excuse me. When a patient knows beforehand that he will have to travel and be absent for more than 4 days, it is always better to stop injections 3 days before he is due to leave so that he can have the 3 days of strict dieting which are necessary after the last injection at home. This saves him from the almost impossible task of having to arrange the 500-calorie diet while en route, and he can thus enjoy a much greater dietary freedom from the day of his departure. Interruptions occurring before 20 effective injections have been given are most undesirable because with less than that number of injections, some weight is liable to be regained. After the 20th injection, an unavoidable interruption is merely a loss of time. So remember that. After the 20th injection. Muscular fatigue. Towards the end of a full course, when a good deal of fat has been rapidly lost, some patients complain that lifting a weight or climbing stairs requires a greater muscular effort than before. They feel neither breathlessness nor exhaustion, but simply that their muscles have to work harder. This phenomenon, which disappears soon after the end of the treatment, is caused by the removal of abnormal fat deposited between, in, and around the muscles. The removal of this fat makes the muscles too long, and so in order to achieve a certain skeletal movement, say the bending of an arm, the muscles have to perform greater contraction than before. Within a short while, the muscle adjusts itself perfectly to the new situation. But under HCG, the loss of fat is so rapid that this adjustment cannot keep up with it. Patients often have to be reassured that this does not mean that they are getting weak. This phenomenon does not occur in patients who regularly take vigorous exercise and continue to do so during treatment. Massage. I never allow any kind of massage during treatment. It is entirely unnecessary and merely disturbs a very delicate process which is going on in the tissues. Few indeed are the masseurs and masseuses who can resist the temptation to knead and hammer abnormal fat deposits. In the course of rapid reduction, it is sometimes possible to pick up a fold of skin which has not yet had time to adjust itself, as it always does under HCG, to the changed figure. This fold contains its normal subcutaneous fat and may be almost an inch thick. It is one of the main objects of the HCG treatment to keep that fat there. Patients and their masseurs do not always understand this and give this fat a working over. I have seen such patients who were as black and blue as if they had received a sound thrashing. In my opinion, massage, thumping, rolling, kneading, and shivering undertaken for the purpose of reducing abnormal fat can do nothing but harm. We once had the honor of treating the proprietress of a high-class institution that specialized in such antics. She had the audacity to confess that she was taking our treatment to convince her clients of the efficacy of her methods, which she had found useless in her own case. How anyone in his right mind is able to believe that fatty tissue can be shifted mechanically or be made to vanish by squeezing is beyond my comprehension. The only effect obtained is severe bruising. The torn tissue then forms scars, and these slowly contract, making the fatty tissue even harder and more unyielding. A lady once consulted us for her most ungainly legs. Large masses of fat bulged over the ankles of her tiny feet, and there were about 40 pounds too much on her hips and thighs. We assured her that this overweight could be lost and that her ankles would markedly improve in the process. Her treatment progressed most satisfactorily, but to our surprise, there was no improvement in her ankles. We then discovered that she had for years been taking every kind of mechanical, electric, and heat treatment for her legs, and that she had made up her mind to resort to plastic surgery if we failed. Re-examining the fat above her ankles, we found that it was unusually hard. Excuse me. We attributed this to the countless minor injuries inflicted by kneading. These injuries had healed, but had left a tough network of connective scar tissue in which the fat was imprisoned. Ready to try anything, she was put to bed for the remaining 3 weeks of her first course, with her lower legs tightly strapped in unyielding bandages. Every day the pressure was increased. The combination of HCG, diet, and strapping brought about a marked improvement in the shape of her ankles. At the end of her first course, she returned to her home abroad. 3 months later, she came back for her second course. She had maintained both her weight and the improvement of her ankles. The same procedure was repeated, and after 5 weeks, she left the hospital with a normal weight and legs that, if not exactly shapely, were at least unobtrusive. Where no such injuries of the tissues have been inflicted by inappropriate methods of treatment, these drastic measures are never necessary. Blood sugar. Towards the end of a course, or when a patient has nearly reached his normal weight, it occasionally happens that the blood sugar drops below normal, and we have even seen this in patients who had an abnormally high blood sugar before treatment. Such an attack of hypoglycemia is almost identical with the one seen in diabetics who have taken too much insulin. The attack comes on suddenly. There is the same feeling of lightheadedness, weakness in the knees, trembling, and unmotivated sweating. But under HCG, hypoglycemia does not produce any feeling of hunger. All these symptoms are mostly instantly relieved by taking 2 heaped teaspoons of sugar. In the course of treatment, I went too far. In the course of treatment, the possibility of such an attack is explained to those patients who are in a phase in which a drop in blood sugar may occur. They are instructed to keep sugar or glucose sweets handy, particularly when driving a car. They are also told to watch the effect of taking sugar very carefully and report the following day. This is important because anxious patients to whom such an attack has been explained are apt to take sugar unnecessarily, in which case it inevitably produces a gain in weight and does not dramatically relieve the symptoms for which it was taken, proving that these were not due to hypoglycemia. Some patients mistake the effects of emotional stress for hypoglycemia. When the symptoms are quickly relieved by sugar, this is proof that they were indeed due to an abnormal lowering of the blood sugar, and in that case there is no increase in the weight on the following day. We always suggest that sugar be taken if the patient is in doubt. Once such an attack has been relieved with sugar, we have... Guys! Shh! Once such an attack has been relieved with sugar, we have never seen it recur on the immediate subsequent days, and only very rarely does a patient have 2 such attacks separated by several days during a course of treatment. Hush. This is Ellie. In patients who have not eaten sufficiently during the first 2 days of treatment, we sometimes give sugar when the minor symptoms usually felt during the first 3 days of treatment continue beyond that time. And in some cases, this has seemed to speed up the euphoria ordinarily associated with the HCG method. Okay, I'm stopping there. Next section is the ratio of pounds to inches. It's getting good, isn't it? Okay, see ya.